here with Dr. Suderman from Javery Pain Clinic, and I'm at Spectrum Health. We're on our way in to talk to Shelley Irwin on GVSU Radio about the opioid epidemic.
Today we're going to talk about other options to manage pain beyond opioids, and also ways that ways that pain affects the whole person, and how we focus on that in developing a treatment plan. So we really hope you enjoy it. Enjoy listening, and hope you have a great day.
Thank you.
Thanks.
Other options for people with acute and chronic pain?
There are many options. At our clinic we specialize in bringing a multidisciplinary approach, and I think I've used that term a couple different times, where we work with other specialists, but also with other modalities or ways to treat pain, medications, non-medications. And our training involves a lot of focus on procedures where we can direct and put medicine directly at the source of pain in someone's body. Oftentimes that's a joint or a nerve in the spine or a knee or a shoulder, and that allows us to precisely administer medication where pain is coming from. And that allows the patient then to use less opioid if that's what they're on, or use a stabilized or safer dose of opioid, and allows them to improve their function, get their life back. When we think about pain turning into chronic pain after a few months, one adage or kind of saying that Dr. Javery came up with and we were talking about recently is, the treatment of chronic pain is the chronic treatment of pain. So we're often walking with patients for months to years, doing procedures, using medications other than opioids, working with a physical therapist, a pain psychologist to help manage pain. We may not take it all away, but we want to focus on your function and help you get your life back.
How can pain affect the person as a whole, and how is this addressed in a treatment plan, Dr. Pullen?
I think we both feel pretty strongly that pain is a large part of people's lives. It can become overwhelming. And when I'm in pain, when I have a headache, something simple that I can take some plain Motrin for and have it be gone, I'm not at my best as a doctor. I'm not at my best as a parent, as a spouse, as a person shopping at Meijer.
Yes.
I'm just not at my best when I'm in pain.
I've got a sunburn right now, and I'm uncomfortable, if you really want to know.
I believe it.
Yes.
Absolutely. And I think that we need to understand that context. And when we understand that context and we understand some of the challenges that that individual may be going through as a result of their pain, then if we can help them learn other ways to manage that pain so that they can function, that needs to be our ultimate goal.
Yeah.
And we often collaborate and work with the patient, and it takes a few visits to really move beyond the focus on a pill or a single thing that will take my pain to a 0 out of 10. It's collaborating, working with the patient, building up trust over a few visits to understand that pain is not defined by the pill you take, what you find on your MRI, or where you're pointing at in your body that has pain. It's your whole experience, and that's how it's defined in academics. It boils down to that patient's subjective experience and how they define what they're going through. And so it involves talking about treatments on so many more levels than just what we can narrow down on that MRI or on that pill you're taking. And when we're able to bring in that whole rounded picture of treatment, of a treatment plan, then that helps to parallel with how we're seeing that experience as a whole person experiencing that pain symptom that they're talking about.
Final words from you, and any teases for us, Dr. Pullen?
Well, Dr. Suderman and I are thankful to be here today, so
Yes.
thank you very much for having us. We always enjoy this time that we're given, and
Yep.
we are looking forward to hopefully talking about some of the new opioid prescribing laws that went into effect this summer in June and July, and some upcoming rules and regulations that are coming from the state level.
Correct. Yeah, thank you for having us. We're looking forward to that conversation in the fall.
How best to find out more information about both of you?
So our clinic is at javerypain.com, 616-588-7246, Javery Pain Institute.
Spectrum Health has a website, sh.org. You can also find specific physicians through Find a Doctor at spectrumhealth.org.
Awesome. Thank you.